अस्सलाम वालेकुम जी, मेरा नाम डॉक्टर अब्बास है। मैं एमडी सर्जन हूँ। मैं आपका मुआयना करूँगा आज। मैं आपका नाम जानना चाहूँगा। मेरा नाम खुबैब। खुबैब, आपके मुँह और हलक का मुआयना करेंगे। जी, जी, ज़रा आपको कहीं गर्द है तो आप मुझे बता दीजिए। जी, ओके। मुँह खोल के बताइए कि आपका मुँह कितना खुलता है। मैं आपके होठों का मुआयना करूँगा और गाल के अंदरूनी हिस्से का मुआयना करेंगे आपका। ठीक है। अब आप ज़ुबान बाहर निकाल के दिखाइए। ओके, दाईं तरफ मोड़िए ज़ुबान को, बाएं तरफ और तालू को भी टच करें। ठीक है, ओके। मुंह खोलिएगा। मैं आपके गले का मुआयना कर रहा हूँ, आपका तालू और टॉन्सिल्स को देख रहा हूँ। ठीक है जी। अब हम आपके मुंह के जुबान के हिस्से को उंगली के साथ मुआयना करेंगे। ठीक है, ऑल राइट। मैं अब आपके सबमैंडिबुलर ग्लैंड की बायमैनुअल पैल्पेशन कर रहा हूँ। Right? So this is the bimanual palpation of the submandibular gland. And similarly, we'll do the bimanual palpation of the other submandibular gland as well. So one tongue on the floor, one finger on the floor of the mouth inside and other on the outside of the mouth. Thank you. So I'm going to show you this ideal mirror. So the identification point of this instrument is it has got a straight shaft and a mirror which is at the tip of this shaft, right? So the straight shaft. And you should ideally be wearing a glove at least on your left hand because you will be holding the tongue with the help of a gauze. That's important. And when it comes to the warming this mirror, so you will be using a lighter or anything which burns on the mirror side of this instrument, right? Not at the back, because this will be touching at the palate of the patient and it should be at ideally less form. So you should be hitting on the mirror side of the instrument. मैं आपके गले का मुआयना करूंगा इस मिरर के साथ। आपने ज़ुबान पूरी तरह से निकाल ली और मैं गॉज के साथ उसको पकड़ लूँगा और ये आपके गले में हम रखेंगे। ठीक है जी। और मैंने इसको थोड़ा सा गर्म किया है, मैं चेक कर रहा हूँ, इतना गर्म नहीं है, आपको भी मैं बता रहा हूँ। ठीक है जी। राइट, पूरा मुंह खोलिए, ज़ुबान बाहर निकालें। शुक्रिया, ऊपर लिखिएगा। ऑल राइट। सो नाउ यू एग्जामिन द बैक ऑफ द टंग, the vallecula, epiglottis, vocal cord movement, and the piriform fossa. Thank you very much. So I have sanitized my hands and we'll be examining the neck of this patient. मैं आपकी गर्दन का मुआयना कर सकता हूँ, इसकी इजाज़त है जी। मैं आप पे बटन खोल के थोड़ा सा आपकी गर्दन का एक्सपोजर बेहतर करूँगा जी। क्या इसकी इजाज़त है जी? थैंक यू। So आप गर्दन को थोड़ा सा इस तरफ मोड़ के रखिए। So now we'll be examining the level 1 lymph nodes, submental and submandibular. Right? We start here at the submental area and then walk backwards and then into the level 2 lymph nodes. Right? So the important point to be noted here is that your fingers should be right in front of the SCM and also the thumb at the back of the SCM. So examining underneath the SCM is important because all of the lymph nodes are located underneath its cover, right? So this is level 2 lymph nodes, this is level 3 lymph nodes, level 4 lymph nodes, and level 5 lymph nodes are in this just above the clavicle and in the posterior neck triangle. And in the similar way, we just walk up into this occipital lymph nodes, and then in the last but not least is the parotid lymph nodes, right? So this completes the examination of the left side of the neck. So similarly, we'll be examining the right side of the neck. So you just extend the neck this way and start at the submental area. So this is the level 1 lymph node, which includes submental and submandibular lymph nodes, and then the level 2 lymph nodes. The important point again here is that we should be palpating in front and back of the SCM. So level 2 lymph nodes, level 3 lymph nodes, level 4 lymph nodes, and then supraclavicular lymph nodes, which are now classified as the level 5 lymph nodes. And then we go on to this tip of the occiput and to look at this occipital lymph nodes. And lastly, the parotid lymph nodes. This completes the lymph node examination of the neck. We'll be examining the supraclavicular fossa for any of the lymph nodes. So in order to do that, you'll ask the patient to shrug his shoulders. तो आप अपने कंधे ऊपर झुकाएंगे जरा। Thank you very much. So at the end of examination, it's very important to cover the patient and re-dip the patient, and you should be buttoning his shirt as well. Thank you very much, जी। बहुत शुक्रिया आपके ताउन का। So I'll take you through the key steps of ENT examination. First of all, that you should be on the left hand side of the patient, right? And sitting at the same level as the patient is, right? And you should be wearing a headlight or a head mirror, whatever your medical school requirement is. And the headlight or the head mirror should be turned on while you are examining the patient. That is important. And you should always be examining the patient while you are sitting. Never standing exam. Never do an examination which is while standing. Thank you. The other thing is that the two mirrors, they are frequently confused by the students. The number one mirror is straight mirror, right? It has got a straight shaft and a mirror at the end. This is the indirect laryngoscopy mirror, right? And this will be held this way to examine the larynx. So this is an ideal mirror. As opposed to a very similar but slightly different is this one. This is a curved mirror. It has a curved shaft and a mirror which is pointing towards north. And this will be held like this, upward, because it's supposed to examine the nasopharynx and the fossa of Rosenmüller. Thank you.